Hey guys, welcome back to Medical Mondays. Happy Monday, happy Labor Day. I hope you guys are all spending the day with your families. So today I want to talk about weight regain after bariatric surgery. It's going to be a two-part video. Let's first start talking about weight regain, or we sometimes call it weight recidivism, after a sleeve gastrectomy specifically. So why do patients regain weight after a sleeve? Two main reasons. One, patients oftentimes will go back to their old lifestyle, eating poorly and making poor choices as far as diet. Secondly, there could be an anatomic issue. So either a portion of the sleeve was left behind that shouldn't have been left behind, or the sleeve was not created properly overall to begin with. So the sleeve is a great operation. We've talked about it in the past. The average weight loss for a sleeve is about 60 to 70% of your excess weight loss, depending on what studies you look at. So what do you do for the patient who doesn't lose either their goal weight that they wanted to lose or what's considered to be a reasonable amount of weight loss after a sleeve? There are several options. Surgically speaking, after a sleeve gastrectomy, depending on what the studies show. So if you notice that there's an area of the sleeve that has enlarged, especially the fundus, or if the sleeve overall has significantly enlarged, you can go in and resize or trim up the original sleeve gastrectomy. Results on this are not as good as some of the other options. If you think about it, you're essentially doing the same thing that was done originally. I tend to do this for patients who didn't have their original sleeve done properly. Second option is to go from a sleeve to a gastric bypass. The biggest reason for why you're losing weight with both these operations is because it's restrictive and hormonal. The bypass adds a malabsorptive portion to the operation. Depending on how much of the intestine you bypass, it'll change how much weight you will lose, but not by that much. We don't have great long-term studies past 5 years to show when patients lose the weight if they keep it off, but on average, depending on their starting weight, patients will lose anywhere between probably about 3 to 7 BMI points. So I don't want you guys to think or expect a dramatic long-term weight loss, but in the short term, most patients lose at least 20, if not 30 pounds, and even up to 50 pounds. Lastly, you can go from a sleeve to what we call a duodenal switch. The duodenal switch is a true malabsorptive operation because we are bypassing a significant portion of your small intestine. So depending on what type of switch you do, there's all these different modifications of the switch. The SIPS, the SADI, the traditional duodenal switch, or DS. The switch is the most powerful weight loss operation that we have today. So if you have a patient who doesn't have severe reflux after a sleeve and who is looking to lose a significant amount of weight, then maybe 10 or 15 BMI points, that patient would do well with a duodenal switch. Patients who do have reflux after a sleeve who are also looking to lose weight, then that patient would be a perfect candidate for the gastric bypass. If you don't have reflux, you're looking to maybe just kind of fine tune, get an extra 15 to 30 pounds off, I think that resizing the sleeve, I think that's a great option for that patient. Okay guys, thank you so much for joining us again on our Medical Mondays. Happy Monday, have a wonderful week, and we'll see you guys next week where we'll talk about weight regain after a gastric bypass.